Thank you for staying. Let's get into the news now. And in our first story, Kasim Rais Belkis, who developed kidney disease, every week goes 3 times for dialysis. Now, there have been times where she's been late for school because she had to undergo that process. Her parents depend on the benevolence of family members to cough out at least 1,500 cedis weekly for her treatment. Rafiq Salam has more in our Dialysis Crisis series today.
15-year-old Kasim Rais Belkis, almost a year and a half ago, was diagnosed of kidney disease that requires her to do dialysis.
It started when my BP started rising and I came to the hospital for a checkup. I was diagnosed with a nephrotic syndrome, kidney disease, and I was admitted here and transferred back to the Kolebe Teaching Hospital, and I came back here to start the dialysis just 15th June and 11 days to 5 months today.
Since she started going to the Upper Wasonya Hospital for the dialysis on June 15, she has been there 38 times, and this session requires at least 450 Ghana cedis for the treatment. The amount of money involved is too colossal for a child of a single parent.
As a single mother I'm born with, she's managing, I'm proud of her, and yeah.
So a week you come here 3 times?
Yeah, sometimes 2, sometimes 3.
So the minimum money paid is 450 Ghana cedis?
Yeah, sometimes the costs take to 1,900, getting to 1,000, so we're just money.
The least amount required in a month to enable her to go for the dialysis treatment at the hospital is 5,400 Ghana cedis. Her grandmother, Amamata Ibrahim, was almost in tears narrating the ordeal they go through to raise the money for the treatment. She has to depend on close family relations to foot the cost of the dialysis for the granddaughter.
I have been supported greatly by my family members. There are others who doesn't have such support. Our plan is even to send her to India for kidney transplant. Dialysis, you cannot afford. How do you pay for the cost of transplants outside?
Transplant. It wants to afford the dialysis. In about a transplant.
Amamata Ibrahim says the amount involved is staggering and should be reviewed downwards.
15 million. Every week, 15
Every
million.
week, we pay minimum 1,500 Ghana cedis. There are even times that we come for a session which is supposed to be 450 Ghana cedis. But you end up by paying 700 Ghana cedis. But we heard government says they want to increase. 450 Ghana cedis we can't pay. And you want over 700 Ghana cedis. Do you want to kill us? Ever since we started this dialysis, at least 6 persons have so far died because they cannot pay. If I want to say more, I will end up crying. I will appeal to government to include it in the list of medication for the National Health Insurance Scheme.
A view shared by her granddaughter, who wants the cost to be subsidized or made to be free.
Because no one has money. You can't even afford a 3 square meal. So how can you afford dialysis 750 or 350? Some people, they are helping them. So sometimes they can't even afford food to eat. How will they afford the 350? People can't afford the dialysis every 3 days a week. So if they just include it in their health insurance, so you can just bring your health insurance so the government can pay part of the bill and you pay part, it will be helpful to them.
Kasim Rais Belkis just finished junior high school and waiting for her results of the Basic Education Certificate Examination BECE. She recalled the challenges she went through at the school before she completed. She was a perpetual latecomer and many occasions was locked out by the school security personnel at the gate.
And I always feel guilty. Why will I be going to school late? And the watchman, he sometimes he doesn't understand. Sometimes he will lock the gates. Why will you be an exception to come to school late? But by God's grace, I was a third-year student and I was able to write.
The dialysis center here has 3 machines, but only 2 are working. As a result, she has to wake up early on any of the treatment days in order to avoid the long queues here.
It's affecting us. We can't just be in line every day. We can't wake up 4 o'clock to be in line just to be first and go back home to rest. Why? We need more machines and more equipment for this dialysis.
The dialysis center of the Upper West Region Hospital was established in November 2022 through support from Asase Foundation. Medical Director of the Upper West Region Hospital, Dr. Robert Amesia, averred that the fee charge is for the maintenance of the machines.
But for a hospital, what we try to do is not to cash in on patients. The reverse side is, if your input cost is higher than your output cost, then you should just prepare for a shutdown of the center. And we know private centers that started and shut down. We know public centers that started and shut down. The machines use light. Now we are required to pay for light. The machines have to be serviced. You need money to service. The people that service the machines are not in YA. They come from Accra. Everything in life has a lifespan, including human beings. After some period of time, you die. These machines are not going to work forever.
Since the establishment of the center, over 5 dozen patients do come here for dialysis. Kurisa Daniel is in charge here at the center.
We do have problems with them because you tell them what is due or what is right for them to do, like coming for dialysis 3 times in a week. Some of them default, and because of the default, some of them develop complications at the end of the day. Some are not even able to come twice a week. They come once a week, and once a week, those doing dialysis, they know. It's just like you are not doing anything. And it won't take long, then complication will start, and the patient automatically, if nothing is done about it, she dies.
Reporting for Joy News, Rafik Salam. Wow.
Well, on our next story, the Archbishop of the Tamale Archdiocese, Philip Name, wants a national dialogue on the state of our national health insurance scheme. He says the scheme, which was supposed to be the savior for Ghanaians, especially the poor, has become a dilemma for most Ghanaians looking for reprieve from a harsh healthcare system. The Archbishop Name called for this dialogue when he joined the staff of the St. Lucie Catholic Hospital to celebrate its 15th anniversary. Martina Bugri now reports.
The St. Lucie Hospital, a Catholic hospital, was started as a mobile health outreach by the Sisters of Mary Immaculate to some communities in the Tamale metropolis, but was later converted to a polyclinic in 2008 and recently attained the status of a primary hospital. Speaking at the 15th anniversary celebration, the Archbishop of the Tamale Archdiocese, Philip Name, said the NHIS has over the years been characterized with challenges including corruption.
Wide concerns of late, among others, have been the National Health Insurance Scheme. For what was supposed to be a savior for Ghanaians, especially the less privileged, the health insurance scheme has rather become a dilemma for most Ghanaians looking for reprieve from harsh healthcare system. The system has over the years been characterized by delays in reimbursement of claims, corruption, and ineffective governance. This leads to high costs of providing quality health and critical staff leaving the shores of the country. These call for immediate stakeholders' engagement to address these emerging challenges.
The board chairman of the St. Lucie Hospital, Dr. Edward Jederi, said even though the hospital has encountered some challenges, they have continued to work hard to achieve successes.
These days, infrastructure development for hospitals, health facilities is more vertical than lateral. So with this problem that is hanging in our hands, I know we will do something. The Archbishop definitely will look at it. His lieutenants are around. We have to do a little bit of vertical development and lateral development. The chairman has intimated about the management of the hospital acknowledges the need of our clients and staff. We are working assiduously towards making St. Lucie the most preferred and attractive facility in Tamale and its environment, and we therefore appeal to our stakeholders to partner the hospital in its quest to reshape its landscape for better quality care and medical tourism as we continue the healing ministry of Christ.
The Municipal Health Director of Sanerigu, George Abraham, said the health challenges facing the northern region is largely drug abuse and accidents.
Our major health concerns in the north and in Sanerigu are drug abuse, inadequate health logistics, inadequate health infrastructure, and motor traffic accidents. This paints a very gloomy picture of the future for what? The Sanerigu district. I believe that with these numerous challenges, that is why we are all gathered here under this well-thought theme, repositioning St. Lucie Catholic Hospital to continue the health healing ministry of Christ in these challenging times.
Now, the Rotary clubs of Accra East and Accra of the United States of America have presented 50 thermal coagulators to the Cervical Cancer Prevention and Training Center of the Catholic Hospital in Bator. Now, the 50 specialized cervical precancer treatment devices would be distributed across the country. The initiative would see the beneficiary health facilities offer a safe and effective alternative to surgical procedures for cervical precancer to save lives, reduce the burden on healthcare systems, and empower women to take control of their health.
Cervical cancer is a malignant tumor of the lowermost part of the womb caused by the human papilloma virus. According to the International Cancer Organization, about 2,800 women are diagnosed with the disease every year in Ghana. About 1,700 patients die from the disease annually due to the lack of treatment facilities, equipment, and specialty. This informed a decision by the management of the Catholic Hospital in Bator to set up the Cervical Cancer Prevention and Training Center to train health professionals in diagnosing and treating the disease. Dr. Kofi Efa is the head of the center.
And these cancers and warts are not only on the cervix. For women, they can cause cancers on the vulva, of the vagina, of the cervix, of the anus, and of the oropharynx, the throat. For men, they can cause cancers of the penis, the anus, and the throat.
To intensify the fight against cervical cancer, the Rotary Club of Accra East and Accra of the United States of America presented 50 thermal coagulators to the center. The president of the Rotary Club of Accra East, Serge Ogan, indicated that it was his outfit's greatest desire to see women burdened with cervical cancer provided the best treatment to save their lives.
And Rotarians are people who are always trying to identify needs in their communities and see how they can take or organize impactful projects. 7 years ago, we were at Bator Hospital to start with them, giving them equipment that could really help them to move forward and to promote the fight against cervical cancer.
The management and trainees were elated about the presentation as it would enhance their service delivery and reduce the duration of treatment.
Together, we want to say we are so grateful to the Rotary Club for this presentation, because previously we screen the women, we get positive cases, and we don't have the necessary equipment to treat them. We end up referring them to Bato or higher facilities, and they end up not going because most of these women are coming at the down there. It is difficult for them to, get means of resource like money to travel. So we are very grateful and we are very happy because now we can screen a lot of people and we can give them treatment. So we are very, very grateful.
These devices, 50 thermal coagulators, going to nearly 50 new institutions in the country. We hope to extend the number of institutions that can offer treatment for cervical precancer. Women will not have to travel long distances to access this service. And I believe that this is going to help in a big way to prevent cervical cancer in this country.
Stakeholders have, however, advocated for a national immunization campaign to protect the citizenry against cervical cancer. Fred Kwame Asari, Joy News, Bato.
Now, a social policy specialist at UNICEF is asking Ghanaian journalists to take charge of the national social protection policies to contribute to its successful implementation. Speaking on the sidelines of a workshop held in Kumasi, Christiana Gbedema said this would institute a collaboration between journalists and key stakeholders in the social protection space to form a network that would actively contribute by informing and sensitizing people to know that social protection is a right. Anas Abed has more.
Journalism plays a crucial role in exposing social injustices, holding governments and other powerful actors accountable and amplifying the voices of marginalized communities. While social protection programs help address the root causes of poverty and inequality, journalism can help promote social justice by highlighting the experiences and perspectives of those who are most affected by poverty and inequality. To help our media personnel in this regard, some selected journalists across the middle zone of the country have received a 2-day capacity building workshop on issues relating to decent work and social protection. The training, according to the social policy specialist at UNICEF, Christiana Gbedema, is to, amongst other things, enable media actors to serve as advocates for social protection.
We are having this training for media colleagues because we want to launch a campaign called Rights and Social Protection this year. But when we developed the strategy for the campaign, we realized that one of the key people that can help us to amplify our voice and share what we are doing is media. And we felt that it's important that we build capacity for media in social protection and why right is important in social protection. So that is why we organize this event.
She added that the media is expected to, amongst other things, champion social protection-related issues and help beneficiaries realize that social protection is a right and not a privilege.
So as we roll out the campaign in the next 2 years, our expectation is that the media will play a key role in making sure that they educate the general public or create awareness on what social protection is, and also create awareness about the fact that social protection is a right for all Ghanaians and not a charity that somebody is doing to them. So this campaign is to ensure that both the person, the duty bearer, and the right holder understand that social protection is not a favor, but it's a right for all.
To these journalists selected from the Ashanti, Bono East, Ahafo and Oti regions, what does this training mean to them?
I've been attending workshops and seminars, but to be honest, this is one of the best training that I've ever had, because what the facilitators taught us, I know that when I put it into practice, it will help me and it will help the society.
This particular workshop has been very, very good. Looking at the things we were thinking through, although there were things I knew already, but I can tell you that I've built upon my capacity.
In what way do they intend to use the acquired knowledge in helping highlight the plight of social protection beneficiaries in their various communities?
What I've learned is social protection is for all. So as a journalist, I'm going out there to also educate the public, especially children and women who are vulnerable in our society as we consider them, to also insist on their right, what is due to them. They should know that it is their right to get those access from government.
Going forward, I think there will be much emphasis on stories around social protection and how we can use our mediums to impact and empower the ordinary citizen.
These trained journalists, together with key stakeholders in the social protection space, including UNICEF, Send Ghana, World Vision, representatives from the Ministry of Gender, Children and Social Protection, amongst others, are set to launch a coalition intended to promote joint action on concerns of interests, advocacy and information management on social protection-related issues. Reporting for Joy News, Anas Sabit, Kumasi.
Well, in 2018, they caused the sun to set on the Akatechies of Opokuwari School, defeating them to qualify to the 1/8 stage. Sunrise Christian SHS is back into the national competition of the National Science and Math Quiz with 6 other private school compatriots. Well, Emmanuel Bright Kweku has been interacting with some of the contestants who promise to cause greater upsets this year.
Sunrise. Ethanoic acid exhibits the same molar units in the vapor phase as in an aqueous phase.
False.
It's false, yes.
They forever remain one of the fondest flashbacks on the minds of students of Opokuwari School. The Santasi Cowboys in 2018 were shaken to the core after first-timer Sunrise Christian SHS sent them packing.
Congratulations to Sunrise Senior High School for winning the first contest at the 1/8 stage and qualifying for the quarter-final stage.
Over the years, the whole base school has proven their worth in the competition after toppling the likes of Holy Child School and Kumasi High School in 2021. This year's contestants could be no different as they promise a mind-blowing showdown in their upcoming contest against Konongo Dumasi and Asaman Kese.
For this competition, we are taking each competition one after the other. And for our first competition, we are expecting you to expect from us a showdown one.
A showdown? Yeah. Hey, do you know what you're talking about?
Yeah,
a showdown. We had someone say they are going to give someone a showdown. So which showdown?
Oh, we will give everybody a mind-blowing competition.
The school, together with 6 other private schools, will be represented in this year's competition.
Charity. We work for excellence.
Having traveled all the way from the Upper West region, Louis Rutten and Region Troppen are ready to make history.
You are going to be meeting Wesley Girls in your category.
Yes, sir.
How do you see that contest?
It looks tough. That's what people say, but we are very confident and we know that we'll do our best and our best will be able to sail us through.
This has been our first time. We don't have any experience in the quiz, but our performance is going to impress them.
We are meeting Bogatanga Senior High School, also from the Upper East region, and T.I. Amas. Okay. And how do you see that contest? Do you see it to be like much of a big match for you, or? Not actually, but because it's all of us our first time, we are just preparing. We've prepared enough, so we'll do our best and leave the rest to God. Overtaking is allowed, so we just want to overtake and get to the final stage. That is our ultimate expectation.
Located in the heart of Gumwa Fete, Hope College is entering the competition poised for action.
The time they met, it was a different set of people. There's a different set of people. So those people had their glories. These people must set their glories. So we are going to be the deciding factors. If they make it, fine. If we make it, fine. But then we can't live on past glories in situations like this.
Hey, we are not living on past. Some schools pride themselves with that. Specifically, going to have won it 7 times. But at least some people say they are undisputed champions.
That's Presec.
But Chemu is not a match?
It's a good school. It's actually a competitive one. I mean, the regional finals, they made it to get that level, so we actually give them the respect. But then we are hoping that we'll be able to match them too in strength.
St. Andrews Senior High School.
Although this may be the first national experience for many of these schools, St. Andrews College is not perturbed.
Moving forward, do you see any of the other schools here as a threat for you?
No. Going through the former stages and then, having that fear and then knowing that, even with the fear, we were able to overcome. How about without the fear? No, we don't find them as threats.
Given the glaring evidence of experience clutching trophies for past winners, time and chance only can tell the fortunes of these students. For Joy News, my name is Emmanuel Bright Kweku.
Well, that's the competitive note on which we cap off the news this morning. But stay with us. The news review is up next.